Influenza vaccination effects on pneumonia in the elderly, PICO question review. Introduction. PICO refers to the acronym for those elements that make up a clinical question. The elements are patient population, P, intervention, I, comparison intervention, C, outcome, O, and time, T. The clinical issue under investigation in this case is whether or not using the influenza vaccine influences the risk of contracting pneumonia during the flu season among persons who are aged 65 and above. There is a great interrelation between pneumonia and influenza. Research has shown that influenza is the major cause of pneumonia infections, especially among elderly persons aged 65 and above. To help reduce the incidence of the two infections, people are encouraged to receive influenza vaccines annually. PICO statement for the area of interest. The PICO question being assessed by the nurse in this case is in patients aged 65 and older. How does the use of an influenza vaccine, compared to not receiving the vaccine, influence their risk of developing pneumonia during the flu season? It is clear that all the components of clinical questions are present. The components are discussed below. Patient population. The population is patients aged 65 and above. The Centers for Disease Control and Prevention, CDC, has established that persons who are 65 and older are more susceptible to influenza compared to the younger and more energetic population. The situation results from the fact that their immune system is weakened. According to the CDC, in the United States 90% of the mortality rates, that are seasonal flu-related, occur among this group of individuals. Around 50 to 60% of hospitalization cases that are seasonal flu-related also occur among members of this population. Pneumonia is one of the flu-related infections causing high morbidity and mortality rates in the population. Intervention. The use of an influenza vaccine is the intervention. The vaccine should be administered annually to the population. The use of the influenza vaccine protects the population against the flu even during the flu season by boosting their immunity against the health condition. Such people are, therefore, at a lower risk of contracting pneumonia. The vaccine should be administered again in the next year. Comparison intervention. Not receiving the influenza vaccine is the comparison intervention. It occurs in two forms. One can either fail to use the influenza vaccine throughout or delay the vaccination process beyond the 1-year limit. Not receiving the influenza vaccination predisposes one to the flu, especially during the flu season. The flu, on the other hand, predisposes one to pneumonia. Outcome. The influence on the risk of developing pneumonia is the outcome. Vaccinated 65-year-olds have a lower likelihood of suffering from pneumonia compared to the unvaccinated. Time. The flu season is the time taken to achieve the outcomes. In this case, the outcomes of the intervention and the comparison intervention can only be well determined during the flu season. At the time, persons aged 65 and above have higher chances of contracting the flu due to their weak immunity. Vaccinated individuals are less likely to contract pneumonia compared to those who are not vaccinated. Conclusion. PICO represents the elements that constitute a clinical question. It also provides a format to be used in the ordering of the elements in the clinical question. In this case, the PICO question posed by the nurse is in patients aged 65 and older. How does the use of an influenza vaccine compared to not receiving the vaccine influence their risk of developing pneumonia during the flu season?